Just about everything in our daily lives costs a lot more these days, including prescription drugs. And sadly, it's seniors already on fixed incomes that pay the price and sometimes cut corners. I'm joined by Leslie Dock, founder and chair, Protect Our Care, with more on what we need to know about these skyrocketing drug costs and how to navigate these tough times. Leslie, let's talk a little bit about the financial and health impact of rising prescription drug prices on seniors. It's really hitting them hard.
Hitting them very hard. And unfortunately, we know that 1 in 4 seniors basically can't afford the drugs they need to stay alive. They're cutting their pills, they're skipping doses completely because they have to make this awful choice between the drugs they need and putting a roof on their head and food on the table. And that should not happen in this country.
How does the Inflation Reduction Act benefit patients?
Now, luckily, as you said, help is on its way, starting in just a few weeks. So if you're a senior on Medicare, for example, and you're a diabetic and you take insulin to stay alive, that insulin price will now be capped at $35 a month, whereas for many seniors, they're paying hundreds of dollars a month. Also, there are a lot of shots and vaccines that are essential to seniors' health. I'm on Medicare. Shingles, for example, is a devastating disease, painful and debilitating. Those shots were $400. Now they'll be free if you're on Medicare, starting January 1st, as well as other shots. And also, the drug companies will be prohibited from these egregious price hikes where they charge more and more every year for the same drug. Now they won't be able to charge more than inflation. If they do, they'll pay a penalty. All that starts on January 1st. And soon after that, other benefits will occur, where your total costs, if you're a senior, will be capped at $2,000 a year, no matter how expensive your drugs are. And finally, down the road, in a few years, Medicare will have the power to negotiate for lower drug prices, so people pay what the drug is really worth and not what the drug companies want to charge you.
Well, Leslie, I wish we all had a crystal ball where we could look at it and say down the road everything's going to be great, but we don't. So we have to look out for each other. So what can be done to further protect patients?
First, I want to be sure that everyone on Medicare takes full advantage of their benefits. So be sure you're signed up. Be sure that if you are diabetic, you're getting the right price, and go get your shots. But we have to stay vigilant because the pharmaceutical industry continues to try and overturn and repeal this law. It makes no sense. 85% of Americans support it, no matter what political party or where you live. So we have to, unfortunately, keep doing the politics of keeping this going. But also, we need to extend these benefits beyond Medicare, so those of us who are insured in other ways also get the benefits. And that's going to take us, frankly, to go back to Congress and finish the job.
Where can we go to get more information?
You can go to our website, protectourcare.org, and also to the Medicare website, medicare.gov, which has a lot of easily accessible, useful information.
All right, Leslie, thank you so much.